With over-the-counter pain relief, that should be only used for like acute temporary type pain. Yes, we're looking at something long and enduring where you can use things like Panadol Osteo, but if you're asking for things that have got codeine added to them, there's no true evidence to show that they're effective at the doses that we have as over-the-counter. So it's only a short acute relief, and then we should be looking at something more long-term if it has to be a long-term. But there is a role for things like Panadol Osteo, where you've got your long-acting pain relief, or your Panamax, 6 to 8 tablets a day. But many patients don't want to take the continual Panadol Osteo type therapy, so then they don't get the pain relief. They go in and out, and that's the hard sell that pharmacists need to be getting across.
So currently in Australia, I believe we have a significant problem with the use of OTC analgesia for the management of pain. I think there are really two branches of managing pain OTC. One is acute pain, and I think the management of the acute pain and using analgesia is appropriate. I think the management of chronic or persistent pain via OTC medication has some serious problems associated with it. In particular, the use of codeine-based preparations is problematic. Codeine is a useful molecule in the treatment of acute pain, but in persistent pain it poses significant issues, and those issues include habituation, constipation, mental clouding, and most definitely hyperalgesia, which is something that we're seeing more and more that's quite poorly recognised. And specifically, it's used very commonly to treat headache, and rebound codeine headaches are a very common and widely a wide problem, often not recognised, that lead to escalating doses of the molecule. The second harm is a lot of the preparations also contain either a mix of either paracetamol and or ibuprofen. Both these things have the potential for harm, particularly the anti-inflammatory, and we're seeing increased numbers of GI irritation, GI bleeds, and then there's the potential for also hypertension, kidney problems that are all associated with its use.
Like a perfect example was we were asked to go to the AMA conference last year, and we're one of the major sponsors there. And it was interesting to note that one of the guest speakers, who actually had a PhD, he actually said that Australia is very close to following the American model that's happening over there in the United States and UK, and that is that prescription drug addiction has now become an epidemic. They're now seeing a different age group of drug addicts. They're no longer, the heroin addicts, the speed addicts, the ice addicts. There's actually mums and dads, the baby boomers, people over 40 years of age now being addicted to prescription drugs, and it's now becoming an epidemic. And this gentleman actually spoke on the benefits of GPs and pharmacists recommending drug-free solutions before the consumer or their patients are actually prescribed codeine or morphine or opiates. And I thought that was really, really interesting, that there is an interest now within the GP society, the medical faculty, that they do realise there is actually an issue here.